before the woman has a child?
Yes, it can be detected before the woman has a child. You know, like I said, you can do the pre-implantation diagnosis before the woman has a child. Then the translocation type, if the mother has the carrier gene, the risk of recurrence is about 3 to 4%. And if the father has the carrier gene, is about 3 to 4%. If it is the mother, is about 10 to 15%.
So they can go on to have healthy children?
They can have healthy children. Yes, it's a probability.
Okay, do we have a problem, behavioral problem, with this type of people?
Yes, most people believe that they don't have behavioral challenges because they have this cheerful outlook. But, you know, they have emotions like every other person. They can get angry, you know. They sense when they are being loved. They sense when they are being abandoned or cheated, you know. So they are prone to having aggressive behaviors in response to the way they are being treated, you know. And that is why there's a need to increase the level of awareness among the general population to love them for who they are, you know, and add value to their life.
Okay, that brings me to the next question. How do you practically advise parents to bring up a child with Down syndrome? Because this is a child who is not as intelligent as maybe their other children or their brothers and sisters when they were growing up. So they may be at a loss. How are we going to bring up this child? What do we do? What's your advice?
One of the first things we do is to correct their own belief about a child, you know, with Down syndrome. You know, we counsel them, we ask them what they know about it, and we correct all their myths. You know, some people believe that they can't live long, they can't be useful to the society, so we correct all this. Then we tell them the challenges that the child can face, you know, and how they can surmount these challenges. Then we also introduce them to support groups. There are parents, you know, that have children with Down syndrome, you know, and have coped well with it. So we introduce them to support groups. And so by this, you know, they are able to meet regularly with them. They get counsel from others, you know, and they are introduced to the larger society. And also we recommend that they go to schools, you know,
normal, regular schools or special schools?
We recommend that they go to regular schools. You know,
can they cope?
Yes, they can cope if there's a structured format in place in the curriculum for them, because they learn at a slower rate than the other children, but they eventually pick up, you know, when they are stimulated early enough.
Okay, so the problem is the beginning.
The beginning.
So if we start early,
there's a need to diagnose them early, refer them to the appropriate doctor, you know, and also institute them in schools that can benefit and improve their life outcome.
Are these children more susceptible to illnesses?
Yes, they are prone to some infections more than the other children because of their genetic constitution. They are prone to recurrent chest infection, you know, but once parents are trained how to pick up these signs and symptoms early, you know, and they present in the hospital on time, it's actually no problem. It's not a curable condition, but some of these problems can be treated well, even in this environment.
Do you advise parents to wait for signs to show, signs of maybe illness or ill health, or do they have set how do I put it?
Follow-up
clinics for them?
Once they present early enough, we have a routine whereby we see them like once in a month or once in every 2 months, you know. And when they come regularly for their follow-up clinics, they don't get tired. We are easily able to pick up all these things early enough. Then it is also advocated that they are supposed to have yearly screening, you know, so that you don't wait for all these things to come up before you detect them. You evaluate them yearly, their eyes, their ears, you know, and every part of their body, you know, you assess them yearly, and you are able to pick up some of these conditions even before they cause disability.
I once met somebody with this condition, and he seemed intelligent enough, you know, could repeat somebody's name or something like that and interact with his siblings. But he had a problem speaking. His speech was slurred. Is that one of the problems that they have?
That's one of the challenges they have.
Is it possible to make them speak well?
Yeah, that is why, you know, one of the management's management skills that we recommend is that a speech therapist must attend to them. And that is one of the reasons why they say they should go to regular schools, because they actually copy other children. They see the way they talk, and speech therapists also assist them. They like to sing, they like to dance a lot. So we use a lot of audiovisual materials to stimulate their language skills. And one of the greatest challenge that a child that can't talk has is inability to hear. So it's important to analyze, their audiology skills, their ability to hear, and give them hearing aids, if they have deficiency hearing, and that will actually improve their ability to talk.
Can these people expect to have a normal lifespan?
Yes, in developed world, the life expectancy in them is about 60, and this is actually close to normal, what we have in developing countries. So if they present early, and all the interventional skills that we have mentioned earlier are put into place, I'm sure they can live up to 60, yes, even in this environment.
Okay. I was concerned about the ability of a Down syndrome sufferer, shall I put it that way, to live without supervision. Is this possible?
Yes, it is possible because, like I said, what they have is subnormal level of intelligence. And if they are stimulated early, they can live semi-independent lives. But the ones that have severe mental retardation will need, to be monitored closely. But over time, they can actually learn some of the skills. They can learn to take care of themselves. They can learn to brush their mouth, do the normal routine that everybody does over a period of time. So it's usually the initial period that is very intensive. If you stimulate them early enough, they pick up like every other person.
Okay, so that means that a Down syndrome sufferer can actually, later on in life, look pretty normal, except for the facial...
Close to normal, I would say.
But don't they have some sort of cosmetic corrections that can be done?
Yes, they can have plastic surgery, to improve their look. They can improve their appearance, if they choose to. And this is already happening in developed countries.
Now, talking about later, the future and all that, are they intelligent enough, independent enough to have jobs, for example?
Yes. Like I said, some of them are educable, they are trainable because they just have mild to moderate level of intelligence. So they can actually learn vocational skills. So this will help them to be independent later in life, and they can actually make money. We have heard of Down syndrome patients that have topped their class.
Topped their class?
Yes.
Of normal people?
Yes. On the internet, you Google, you see some of them have topped their class. Some of them have fantastic paid employment. Some of them are even married, They have fantastic relationships. They can get married to each other, and if they are lucky enough, they can find their own love.
But there is always the problem, isn't there, of a person who maybe marries a fellow Down syndrome person, of having children who have Down syndrome. The possibility, isn't it higher?
The possibility is higher. The risk of recurrence, if a Down syndrome patient marries each other, is about 50%, but there is that probability of them having a normal child.
So, if a Down syndrome patient wants to get married and is opportune to come to the hospital, maybe with the prospective partner, and you have to counsel them, do you tell them about these possibilities? Can they understand the implications going forward in getting married?
Well, it depends on their level of stimulation. If they have been stimulated well enough, they're able to read and write, and they understand a few, forms of communication, audiovisuals. So you can actually show them the pictorial display of a karyotype and show them that there's a likelihood that you can have a child with Down syndrome. I think they will understand. Most of them can communicate well, and their speech improves with time, especially when they get a speech therapist early enough.
We'll take a break now. We'll be coming back shortly, right after the commercial break. Stay with us.